remember that one of the ways through which probiotics exert their healthful impacts is through modulation of histamine. And so in this case, probiotics, as I've said so many times, exerted a net antihistamine effect. This is why less Zyrtec, less antihistamine medication was required when using probiotics, because probiotics have a net or a total antihistamine effect. This is really important to keep in mind because every once in a while in the clinic, someone is ardently avoiding probiotics because they have suspected histamine intolerance, or they're unnecessarily using a complicated probiotic that's histamine-free because they suspect they have histamine intolerance. Hey everyone, this is Dr. Ruscio. Let's go over some exciting updates in probiotic research. I have about 10 studies that I'd like to detail for you, which I think can help you better understand how and why to use probiotics. Alrighty, so let's jump in with the first study. This study was attempting to answer the question, can probiotics improve cognition? The intervention was a randomized control trial in 78 adults over 65 years of age with mild cognitive decline. And they were randomized to receive either control, a placebo, or a probiotic as Lactobacillus plantarum. Now, when the probiotic group was compared to the controls at a 3-month follow-up, there was no change in overall memory or in verbal memory, but there was an improvement in visual memory scores. So, a minimal finding of probiotics being able to improve cognition, and why or how it is that probiotics may improve cognition, even though this study didn't have a strong finding, is for a few reasons. Probiotics may improve nutrient absorption, probiotics may reduce inflammation, and probiotics may also reduce the amount of toxins that enter this sort of enterohepatic cerebral loop. There's a condition known as hepatic encephalopathy where toxins cannot be adequately filtered by the liver. They build up in the blood, they cross a blood-brain barrier, they get into the brain, and they can cause brain fog. So there's this gut-brain connection, this gut absorption connection, this gut inflammation connection, amidst perhaps a few others. But we want to ask the question, will an intervention improve an outcome? And in this case, there was improvements in visual memory, which is something, but no change in overall memory or in verbal memory in this one study vectoring or giving probiotics to adults. Now, this next study looked at probiotics and if they can help in the treatment of H. pylori, Helicobacter pylori. The intervention was a randomized control trial in 180 participants with H. pylori, and they received either quadruple therapy, which is the standard medical treatment for H. pylori, either triple therapy or quadruple therapy, or they received that quadruple therapy plus a probiotic. And this probiotic was essentially a blend of Lactobacillus, Bifidobacterium, and Enterococcus. Now, after 2 weeks, the addition of the probiotics led to a greater eradication of H. pylori, 88% clearance when given the probiotic, as compared to a 79% clearance when not given the probiotic. Also, there was a reduced recurrence rate of H. pylori coming back after 3 months. 7% of individuals had recurrence whom had the probiotic, whereas 13%, nearly double of those who did not receive the probiotic, experienced a recurrence of H. pylori. And the final point here, there was a reduction in serum gastrin, which may tell us there was a normalization or improvement in the output of hydrochloric acid, although the relationship to gastrin and HCl is not a one-to-one or a very direct relationship, but we can draw that inference semi-safely. Now, the final point here is also interesting in that there was no difference in side effects between groups. And this is a little bit counterintuitive because so many datum have found that probiotics, when co-administered with antibiotics, can actually reduce the antibiotic-associated side effects. And remember, quadruple therapy is fairly heavy in the use of antibiotics. But a good reminder that not every study will find the same thing. And a great finding here in the sense that people will have improved clearance and a reduced risk of H. pylori coming back when they add probiotics to their quadruple therapy for H. pylori. And remember that sometimes people will say, well, I'm going to wait until after the antibiotics to start on the probiotics because won't the antibiotics kill the probiotics? That's an understandable supposition, but it actually doesn't seem to be the way this works. There have been so many trials now that have shown us clearly that antibiotics are synergized by probiotics and that the probiotics also reduce the side effects from the antibiotics, as this study partially supports. So remember, if you are going to use an antibiotic, it's a great idea in nearly all cases to use a probiotic at the same time. Check on this with your doctor, but that is the general trend in the evidence clearly. The next study wanted to assess, can probiotics treat SIBO in pregnant women who also have hypothyroidism? Remember that some emergent data is showing that those who have hypothyroidism are at an increased risk for SIBO. So as we've documented in the clinic and with some of our clinical research that we've published, there is this tight correlation between what's happening in the gut and what's happening with thyroid. And one of the specific items that underlies that is those who are hypothyroid have an increased prevalence of SIBO. So this study wanted to look at that along with when this is occurring in a cohort of pregnant women. So as I just kind of alluded to, hypothyroid women had higher rates of SIBO at 49% as compared to those who are not hypothyroid. So almost a doubling of the risk. The intervention was 3 weeks of treatment in those pregnant moms who had SIBO and hypothyroid, and they were given either a probiotic or a probiotic-prebiotic combination. And what they saw was a 46% eradication rate of SIBO. 46%. That's pretty impressive for just using the intervention of probiotics. I shouldn't say just. It's actually quite a powerful intervention, but perhaps sometimes it is mistakenly believed that antibiotics are going to be significantly stronger. And at least according to the best meta-analyses that we have, the impact or the clearance rate of SIBO from rifaximin as compared to probiotics seems to be similar. Now, the data here are not necessarily apple to apple. There's more data on rifaximin. Usually with more data, the effect size diminishes. So the data here could be a little bit skewed when I say they're equal, and it may not, again, be an apple to apple comparison. But as a general rule, the data here show rough equivalency between antibiotics versus probiotics to clear SIBO. And that's partially what you're seeing here with the 46% SIBO eradication rate when these pregnant hypothyroid moms were treated with probiotics. There was also a 23% resolution of gastrointestinal symptoms, a 39% reduction of methane levels. And remember that methane is the gas that can underlie constipative type SIBO or just constipation in general. So some nice evidence here that probiotics can address the methane type of SIBO. And correspondingly, there was a 19% reduction in constipation. And look at this next point, a reduction of TSH by 0.7. Now that's not a huge reduction, but the one point I'd like to impress upon you here is that when someone is taking, let's say, levothyroxine, and they have impaired absorption, they will see a suboptimal impact from that levothyroxine on their TSH, either suboptimal or inconsistent. Now, if we can improve absorption, people will oftentimes need less medication. This is something that we've published, and there have been a handful of papers that have supported when someone does not have optimal gastrointestinal function and they are given therapies to improve gastrointestinal function, therefore they have improved absorption, they actually require a lower dose of whatever thyroid hormone they're on, let's say levothyroxine, to maintain a normal TSH level. And that's exactly what you're seeing here, with the small but significant reduction in TSH of 0.7 just through using probiotics to treat SIBO in these hypothyroid pregnant mothers. Now to the question, what type of probiotics were used? This was a combination of Lactobacillus, Enterococcus, soil-based, and inulin in this study. Some of the details there I'm not exactly clear on. This is just to give you sort of the high level of what are we seeing across multiple studies and their impact, in this case, of probiotics on SIBO in pregnant moms. So a great study there in this group of about 200 controls and 200 treatment moms. This next study asks the question, can probiotics improve runny nose or allergic rhinitis in children? The intervention was to summarize 26 randomized control trials of about 2,600 kiddos or pediatric patients, and it was a control versus probiotic design. So this is a meta-analysis summarizing all of these 26 control trials. Now, when compared to controls, so we're factoring out for placebo, the probiotics led to reduced nasal symptoms, a 1.2 times increased resolution of nasal symptoms, improved quality of life, a reduction of the duration of Zyrtec needed by almost 3 days, and also a reduction in inflammatory cytokines, and finally, no adverse reactions occurred. So this is great news. If your child is having allergic rhinitis or a runny nose, probiotics are an intervention to consider that may improve their quality of life, reduce the duration of not feeling well, reduce the amount of Zyrtec needed, and remember that one of the ways through which probiotics exert their healthful impacts is through modulation of histamine. And so in this case, probiotics, as I've said so many times, exerted a net antihistamine effect. This is why less Zyrtec, less antihistamine medication was required when using probiotics, because probiotics have a net or a total antihistamine effect. This is really important to keep in mind because every once in a while in the clinic, someone is ardently avoiding probiotics because they have suspected histamine intolerance, or they're unnecessarily using a complicated probiotic that's histamine-free because they suspect they have histamine intolerance. And while that makes sense in theory, again, the outcome data here are clear that probiotics have a net antihistamine effect. Now, this is not to say that someone who is a bit reactive may not react to a probiotic. Some people will react to probiotics, and this is why we break them out in the clinic into 3 different types, so you can try each one independently, figure out which one sits well, which one might cause a reaction, use the ones that help, and leave aside the ones that don't. But this is not mediated by the histamine content of the probiotic. And again, the way we group these is a Lactobacillus and Bifidobacterium blend, kind of your traditional probiotic, a Saccharomyces boulardii, the healthy fungus, and a soil-based probiotic. And this way, the individual can try the formulas, figure out what works, get the net antihistamine benefit, leave aside the ones that are reactive, and really make the application of probiotics simple. Alrighty. The next study, again in kiddos. Can probiotics prevent eczema in infants and children? This was a meta-analysis summarizing 11 randomized control trials in mothers and infants. And most of these individuals had a family history of allergic conditions. They were randomized in these trials to placebo versus control. So again, we're guarding against the placebo effect. And the probiotic intervention dosing window varied from 1 month prenatal to 3 months to taking up through 2 years postnatal. So said more simply, the length of time that moms were using probiotics varied, because remember, there's 11 different trials that are being assessed here. So we see different applications across them. Here's the most interesting point. Probiotics led to a reduction in pediatric eczema by 40%. Now, this didn't occur in all groups, but there was a trend of reduction in eczema when using probiotic supplementation. The probiotics that were used were either Lactobacillus rhamnosus alone or a combination of various Lactobacillus and Bifidobacterium species. And probiotics were most effective when consumed prenatally, plus either in the breast milk from mom, meaning mom had them and they came through the breast milk, or if they were given directly to the infant. So this kind of hints at this concept of the earlier we administer a probiotic, the more favorable the benefit may be. And this is likely because the gut microbiota forms by around the second, third, maybe fourth year of life. And this is when the microbiota is most amenable to either healthy or unhealthy influence, depending on what you're doing. And remember that the gut microbiota is intimately tied in with immune function. And this is why we likely see that the earlier we administer probiotics and have a favorable impact on the gut microbiota, we see a carryover to this immune-mediated condition of eczema. So a great study. And if you are a mom with a history of allergy or atopic dermatitis or eczema, perhaps psoriasis, you may want to consider using a probiotic while pregnant and then also while nursing and even into the child's introduction of foods so that you may prevent eczema, as was seen in this study by roughly 40%, again, not in all groups, but at least a trend of a benefit in this meta-analysis. Coming over to probiotics and their ability to improve glucose levels in diabetics or in pre-diabetics. So this intervention was another meta-analysis summarizing 46 randomized control trials in roughly 3,000 patients. Compared to controls, those receiving probiotics or symbiotics, which is a combination of probiotics and prebiotics, saw improvements in their fasting glucose by 11 points. That's significant. Their fasting insulin by 1.2 points. Insulin resistance by nearly a point, and hemoglobin A1C by about 0.35%. So a great study here showing a modest to minimal but significant impact of probiotics on glucose and glucose metabolism. So bear this in mind. Also, just want to be careful to say, this will not be enough to manage frank diabetes, probably obvious, but maybe a nice intervention. Let's say if someone is using metformin, metformin is known to have some GI side effects. This may allow a lower dose of metformin being required and a lower incidence of gastrointestinal side effects. So consider this or consider discussing this with your doctor. The next study, can probiotics help clear prostate infections? So this study looked at 104 infertile males with bacterial infections, either in the prostate or the seminal vesicles, and they were given antibiotics alone or antibiotics plus probiotics. The eradication rate of the infection was found to be 76%. So a 76% eradication rate in those getting probiotics plus antibiotics compared to a 50% reduction rate in the antibiotics. So either way, a win, but clearly better results when using the probiotics along with the antibiotics. What's also interesting here is the sort of distal impact that an oral probiotic that makes its way through your gut has on prostate and seminal vesicle function, which shows us that what's going on in the gut and the gut's intimate connection to the immune system can have a carryover benefit to even areas outside of the gut that may have an infection that we're trying to clear with the use of antibiotics. And in this case, The probiotic was a combination of Saccharomyces boulardii, Enterococcus, and Lactobacillus. The next study, can probiotics improve IBS? The intervention was summarizing 10 randomized controlled trials in nearly 1,000 patients with diarrheal type IBS. They were given either probiotics or placebo. Again, so important to guard against the placebo effect. Some studies in IBS have found that the effect of placebo in placebo-controlled trials, so when we're trying to guard against placebo, is about 45%. So really important to safeguard against the impacts of placebo or try to mitigate it as much as we can. Okay, so when compared to placebo, the probiotic group saw improvements in IBS diarrheal symptom scores with a moderate effect. And we grade these by minimal, moderate, and large, or small, moderate, large. The effect size is important because there are some things that can be considered statistically significant, but not clinically meaningful, meaning the effect size is so small that while it's not mathematical chance, it is something that a patient would go, didn't really help. So if we're seeing a moderate effect size to a large effect size, this is usually when an individual will be happy with the result. So in this case, a moderate effect on IBS diarrheal symptom scores, a small effect on abdominal pain, so perceptible but minimal, a small impact on abdominal distension, and interestingly, probiotics did not improve quality of life. And the probiotics that were used were either Lactobacillus and Bifidobacterium blends or Saccharomyces boulardii. Again, we're looking at 10 clinical trials, so there will be some heterogeneity amongst the formulas used in each trial. What I find so freeing and insightful about looking at these meta-analyses is it shows us that in IBS, diarrheal type, different probiotics can have this positive impact, which tells us that we don't have to be uber specific about the probiotic formula. This can help patients not be stuck on this probiotic merry-go-round, but rather understand that a good clinical intervention with probiotics can be reassessed after about a month, and that will tell you the type of impact that you can expect to see. And from there, you can move on, and you don't have to flounder for too long trying all these different formulas because, again, as this study shows, different formulas can produce the same effect because probiotics don't work like drugs. They're not targeting a specific pathway. They're helping to improve gut health. And as a second order effect of that, you may see improved cognition, improved eczema, what have you, improved clearance of an infection, or improvements in your IBS. The next study looked at zinc carnosine, which may help with repair of the gut lining, which is why you see zinc and zinc carnosine in some leaky gut supplement formulas, and its ability to help clear H. pylori infections. The intervention was to summarize into a meta-analysis 3 studies, 3 randomized controlled trials of about 400 patients with H. pylori infections. They were randomized to either triple therapy this time or triple therapy plus zinc carnosine. After 1 to 2 weeks, the addition of the zinc led to a greater eradication rate, 86% as compared to 70%. So 86% versus 70%, and there was no difference in adverse events. So some interesting findings here that if we support the lining of the gut, presumably a healthier gut lining will be more amenable to clearance of an infection, because remember that it's not just the antibiotic that helps with clearance of the infection. It's really this synergistic or this collaborative effort between the antibiotic and your immune system. And one way of thinking about this is if an infection is to a point where the immune system cannot combat it, then an antibiotic can help tip the scale in favor of your immune system, sort of dampening the level of the infection down to a point where now the immune system can come in and finish off the job. So if zinc carnosine helps improve gut lining health, and therefore things like the galt and the malt and essentially the gut-associated lymph tissue and immune system can work better, then we should expect to see an improved clearance rate of infections as this study finds. So this is a good additional reminder that other therapies, zinc, probiotics, can synergize with antibiotics and make the antibiotics more effective. This next study looked at probiotics and their ability to reduce inflammation and improve antioxidant levels in diabetics. And remember, there seems to be this general inverse association between inflammation and antioxidant status. The more inflamed you are, you utilize your antioxidant pool. So in this case, with the higher amount of reactive oxygen species and inflammation that's seen in diabetes and in prediabetes, these individuals will have higher levels of inflammation, therefore potentially lower levels of antioxidants. So this study was a meta-analysis summarizing 32 randomized control trials of about 2,000 patients with either prediabetes or diabetes into either the control, which was placebo or usual care, versus probiotic. And what they found was probiotics led to improved C-reactive protein, TNF-alpha, an inflammatory cytokine, glutathione, and total antioxidant capacity. So we showed a moment ago that the use of probiotics will have a mild to moderate favorable impact on glucose metabolism, and another study here showcasing that probiotics may reduce inflammation associated with high blood sugar and kind of concomitantly improve antioxidant status. So a nice adjunct to those trying to manage metabolism, specifically glucose metabolism, and some of the downstream effects like inflammation that can occur as a result of that. And this next study wanted to assess, can probiotics plus omega-3s reduce inflammation in inflamed elderly subjects? The intervention was a randomized control trial with 76 participants between 65 and 80 years of age with low-grade inflammation as assessed by your highly sensitive C-reactive protein. And they were randomized to placebo or a probiotic as a blend of lactobacillus and bifidobacterium plus omega-3. After 2 months, the combination of probiotics and omega-3 supplementation led to no reduction in CRP. So the null was the finding here, and a good reminder that not all interventions show a favorable benefit. Probiotics are certainly not an anti-inflammatory panacea, and it's important that we as the scientific community and healthcare consumers are able to be showcased negative findings in addition to positive findings, because there's this thing known as selection bias or publication bias, where positive findings tend to dominate negative findings. This even goes all the way up to medical journals, where journals are more likely to accept new and novel or positive findings over negative findings. But the negative findings have a time and a place. They help bridle us from falling into the confirmation bias of only looking at the studies that find probiotics have a favorable impact. What we should be doing is looking at all of the data to get a sense of, will this intervention help or will it not? And if so, what is the probability? And I think that's the key phrase, is probabilities. We want to be thinking about these interventions, how and when to use them on a gradient of probabilities, not a yes, no, good, bad, black and white, but rather what is the probability that this intervention will help? And then we can look at a number of interventions and rank order those according to probability, meaning what is the highest probability of benefit, the second, the third, and the fourth, also put in order of invasiveness and cost. And then we can develop this interventional hierarchy that will help us navigate therapies the most effectively, rather than falling into this sort of absolutist thinking of it's all about probiotics or probiotics don't work at all, or whatever the intervention is. So probabilities. And in this case, one note that bridles the enthusiasm regarding probiotics in their ability to be anti-inflammatory. Now, here's another study almost finding the opposite. Can probiotics improve the results of ulcerative colitis, medication treatment, namely the 5-ASA drug mesalamine. So the intervention here was another meta-analysis. So we're getting a meta view on 19 randomized controlled trials, looking for the trend in the data of 1,700 participants with ulcerative colitis who were randomized to receive mesalamine alone, probiotics alone, or mesalamine plus probiotics. Now, compared to the controls, the mesalamine plus probiotic group saw improvements in the clinical effect of treatment by 5 times, and improvements in treatment side effects, so a 57% reduction in the side effects from mesalamine, an improvement in ulcerative colitis scores, and improvements in inflammatory markers. So the best intervention here was not probiotics alone, was not mesalamine alone, was mesalamine plus probiotics together. And the probiotics that were used were either a blend of Lactobacillus bifidobacterium, Enterococcus, and or a soil-based probiotics. Again, looking at 19 trials, there's going to be some difference in the specifics of the formulas that were used, which I keep trying to reiterate here. Sorry if it's a touch trite. That's okay. That tells us that we don't need an uber specific formula if you have ulcerative colitis and are taking mesalamine, but rather different formulas can all show a favorable impact, thus simplifying the landscape of using probiotics. Coming back to kiddos, can probiotics improve respiratory infections in children? The intervention, a randomized control trial looking at 192 healthy infants between 6 and 12 months, randomized to either formula, the control, or formula plus Bifidobacterium animalis, or formula plus Lactobacillus rhamnosus. After 3 months, the addition of probiotics led to reduced physician-confirmed upper respiratory tract infections, URTIs, improved parent-reported upper respiratory tract infections, and a reduction of antibiotic or antiviral prescriptions required. Now, in this study, there was a slight edge for the Bifidobacterium animalis. However, either intervention worked. Either probiotic worked. And my argument, as it has always been, is a multi-species probiotic intervention is probably better than a monospecies, meaning one intervention. That was not studied here. That's just my perspective. And what we're seeing here is irrespective of the probiotic used, they were both effective and helped reduce antibiotics, antivirals, and the amount of days that kids had these respiratory tract infections. Coming back to the GI, can probiotics improve diarrhea? And this was a really interesting study design. It was a meta-analysis of 16 randomized control trials looking at just under 1,600 patients with diarrhea from various causes, diarrheal IBS, acute diarrhea of unknown cause, idiopathic, or even a C. diff infection. And they were randomized to either control or probiotics. Now, the control was a tough control. It was a tough comparator. It was either placebo or low FODMAP diet, which can be highly effective for diarrhea, or antibiotics. So this is a great study design in the sense that it's going to pit antibiotics. Picture a gladiator fighting arena. Now, probiotics are going to fight low FODMAP and duke it out, or probiotics will fight antibiotics and see which one has the higher efficacy. So this is a nice comparison trial. Compared to the control, remember the control in the arena here are either placebo, that's easy to beat, or low FODMAP, tough to beat, antibiotics, tough to beat. So compared to the controls, probiotics led to improved IBS symptom scores and stool frequency. So even when pitted against some pretty tough competition, probiotics still found improvements in IBS symptoms and in stool frequency, again, when compared directly against low FODMAP or to antibiotics. Now, probiotics did not lead to greater improvements in stool form or in IBS quality of life. So again, not a panacea, not an either or, but to impress upon you the strong utility that probiotics have, namely here for diarrhea. And the next study wanted to examine, can probiotics improve inflammatory arthritis? And if you are an active person as I am, you get annoyed by aches and pains that can slow you down. So what can probiotics potentially offer here? Well, this was a meta-analysis that summarized data from 34 randomized control trials on 8 different types of inflammatory arthritis, again, treated with probiotics. And the probiotic supplementation led to improvements in rheumatoid arthritis, autoimmune, by reducing CRP with a large effect size. There was no change in joint pain, joint swelling, or another inflammatory marker, erythrocyte sedimentation rate, but nonetheless, some minimal but favorable impact on RA. Psoriasis, remember that there is psoriasis arthritis, separate from the skin lesions, but those who have skin psoriasis are known to have psoriatic arthritis. So there was improved objective psoriasis severity with a large effect size, improvements in gout via reduced uric acid with a moderate effect size, improvements in osteoporosis or osteopenia, so improved bone mineral density, albeit the small effect size, very interesting in the sense that this tells us likely there's an improvement in nutrient absorption from the probiotics, thus allowing better calcium deposition in the bone. And there are some studies, albeit not many, that have documented that probiotics can help with absorption of certain nutrients. Also an improvement in osteoarthritis, improved joint pain, really care about that, and a reduction in the inflammatory marker CRP. There was also an improvement in inflammatory bowel disease associated arthritis. Now, the other side of the coin, probiotics did not lead to improvements in spondyloarthritis. This means inflammation in the joints of the spine. Did not lead to improvements in juvenile arthritis. And what type of probiotics were used? In this case, it appears to have been Lactobacillus bifidobacterium along with, or a soil-based type of probiotic, or a Streptococcus and Enterococcus species. So again, there's a smattering of different types. One could argue we should make probiotics more complicated. I would argue the counter. Zooming way out, we see here RA, psoriasis, gout, osteoporosis, osteoarthritis, IBD-associated arthritis, C, a greater or lesser degree of improvement, with no improvements in spinal arthritis and in juvenile or kids with arthritis. So great finding here, and something that I certainly am glad I'm using a probiotic, because again, aches and pains and missing days from the gym are a real pain in the butt, I guess, both figuratively and literally. Okay, well, that is it. Those are the 10 or so studies that I wanted to cover. Hopefully you are finding this information on probiotics as interesting as I am. A few points in close. Probiotics are not a panacea, but the data are also pretty compelling. Look at all these benefits. We also don't have to use probiotics at the exclusion of meds. In fact, quite to the contrary, many of these studies have found that probiotics work better when co-administered along with medications, if there's a medication being called for, depending on the condition. So, a really fascinating area of research, probiotics, one of the mainstays of what we use in the clinic, but also something that I fear and observe. There is so much confusion from patients. A lot of this comes from market influence permeating the internet with all sorts of marketing claims, confusing the consumer. So if we zoom out and look at the macro data, we see that different probiotic formulas have shown to help a multitude of conditions. So don't overcomplicate the application of probiotics. We have a number of materials that can help you with how to get started. And remember, this is a relatively inexpensive, very safe intervention that can help multiple systems and symptoms. And hopefully, if you're not on probiotics, this data motivates you to give them a prudent therapeutic trial to see if they can lead to clear benefit for whatever it is you might be suffering with or are trying to optimize. Alrighty, this is Dr. Ruscio, and I'll talk to you next time.